truth, namely that antidepressants often do not do what they promise and are in fact causing harm to many.
Dr. Steve Hotze is suing over Obamacare's employer mandate.
It's time for a wellness revolution. Brought to you by Hotze Health and Wellness Center. Honest discussion on maintaining health and wellness naturally to enjoy a better quality of life.
He's the doctor fighting to let you keep your doctor.
Now, Dr. Stephen Hotze.
Good afternoon. Thank you for joining us today at Dr. Hotze's Wellness Revolution. I'm Stacey Banfield here with Dr. Stephen Hotze, and you have been listening to SDA Money Hour with Luke Patterson and Mike Smith. Great couple of guys, and we're so glad that you're joining us here at Dr. Hotze's Wellness Revolution, along with Crystal Hammett, our certified nutritionist, which means you get an update on your vitamins. Hit it, Mr. Producer.
Vitamin and mineral supplementation mentioned in this radio segment are for the benefit of your health and not the detriment of it. You will not experience any odd or uncomfortable side effects if you have been accustomed to hearing in pharmaceutical advertisements. The discussion of lifestyle choices and proper nutrition does not require a long drawn-out disclaimer providing millions of reasons why you should be afraid, very afraid. You will not experience sudden changes in moods or behavior, depression, thoughts of suicide, agitation, or other mental health problems. Vitamin and mineral supplementation will not cause an increased risk of heart attack or stroke, stiff muscles, confusion, or uncontrolled muscle movements that could become permanent. In addition, you will not experience high blood sugar or extreme high blood sugar leading to coma or death, decreases in white blood cells, dizziness upon standing, seizures, trouble swallowing, impaired judgment or motor skills, or increased risk of death. As a matter of fact, we don't even need this cheesy background music to cover all the deleterious side effects that you hear in drug commercials. We're all natural, and that's revolutionary. Now for your vitamin update with Hotze Vitamins.
Crystal, welcome to the show. And for everyone out there who has access to an iPad, an iPhone, or any other smart-looking device, you can say hi to Crystal on Facebook Live. Just go to Hotze Health, and you can see Crystal right now with Dr. Hotze.
Crystal, thanks for joining us today. We're talking about, want to visit about heart health and what keeps the heart healthy and what keeps our heart full of energy. This is really important because what we have found is we do heart scans on our guests that are above 40 years of age. We find about 40% of those individuals above the age of 40, usually above the age of 50, have some atherosclerosis, hardening of the arteries, calcification of their coronary arteries, which adversely affects the blood flow to the heart muscle. And the blood flow, of course, when it's impaired, cuts down on the available nutrients and the vitamins and minerals and the oxygen that the heart muscles need to function properly. Now, the heart muscles require a tremendous amount of energy because they're beating 72 times a minute, 100,000 times a day. Mm-hmm. So they need a lot of energy. And the mitochondria, which are the power plants within those cells, need to have the proper nutrients in order to make the adenosine triphosphate, the ATP molecule, yes, which carries all the energy into the cells. One of the most important nutritional products that you can take to make sure you produce good energy in your cells is D-Ribose. So why don't we talk about that?
Yes, let's definitely talk about that. So D-Ribose comes in two forms, which is very convenient. You get the capsule or the powder form. So no excuses. If you don't like to swallow pills, you don't have to. It's really, really important for the mitochondria, for the ATP, for the energy production that you're talking about. And what's really neat is it's essential for everyone, not just these heart healthy patients that are needing a corrective issue. It's very preventative, but it's great for athletes as well. It gives them performance and endurance while exercising, improves that performance and endurance. A tip is actually to put the powder in their water bottle, and you can sip on it through the workout. And it's also going to help with muscle recovery, so you can take it before and after. So really, really important for athletes, but probably even more important are those people that have had a heart attack. It's essential that you take D-Ribose right after a heart attack. Hopefully it doesn't get to that point, but it's going to be essential for helping recover from heart attack as well. So there's a lot of very important components and reasons to take that D-Ribose, but it comes from cranberry. It's a sugary flavor, so it tastes good. Another non-excuse that I can't write that off, but it's definitely going to be something convenient for anybody to take, and as you said, so necessary for that energy production, preventative, corrective, just a great supplement.
It is. Now, D-Ribose is the building block for adenosine triphosphate, ATP, alpha, Tom, Paul, ATP, is the energy molecule that your cell's power plant, the mitochondria, produce, and that carries the energy to all the areas of the cells where you're making proteins and enzymes and carrying out other biochemical processes. Think of your body as a big, is a generator of electrical energy. It's electrical current that are carried in electrons that enable the biochemical processes to have energy to function. So people, you've seen people in your life, and you've called them, or people have mentioned, boy, they're a live wire. They seem like they're full of energy. And they are. They're high energy people. They're producing a lot of energy within their cells. Many individuals have low energy production. When you have low energy production, your cells don't function well, your organs don't function well. The building block for the energy molecule in your cell from the mitochondria where it's made is D-ribose. It's a 5 carbon sugar. It's a sugar.
Right.
And the body makes it from glucose. It converts glucose to ribose when the body is functioning well. But individuals that are under stress or that stress themselves in athletic competition, you burn up a lot of the energy molecules, and you have to recapture that. You have to, what do we call it? Recover. You've got to regenerate these molecules in order to recover. And it takes time to do that. That's why it's important to have D-ribose available. And you can take this as a supplement. And it's completely safe. It's a 5 carbon sugar. You take this with a glass of water.
Exactly.
And we recommend just routinely for those individuals that are in good health, take 5,000 milligrams a day. It's 1 teaspoon.
Yes.
You dissolve it in water or whatever you want to drink it with. Iced tea. I drank mine with
iced tea. Put it in your smoothie.
Put
it in your smoothie.
Put it in the smoothie in the morning. If you have a history of heart disease, a history of coronary artery disease, we recommend 2 teaspoons or 10,000 milligrams. If you have a history of congestive heart failure, then we recommend 15,000 milligrams or more of your D-ribose.
Yes.
So, and for the heart, if an individual has coronary artery disease, it's important for them to take vitamin C, magnesium, coenzyme Q10, acetylcarnitine, and
proline and lysine.
Well, proline and lysine are very important as well to help clean out the artery, and K2 is important. And so these are, as well as D-ribose.
Yes.
So these are some things. Now, I know this works. I just got through seeing a guest of ours, a longtime friend of mine, been a guest here for years. 9 months ago, we did a heart scan, and he had a very high score. I just saw him before this program began and had a repeat heart scan on him. His heart scan in 9 months on the program, he had 20% decrease in the calcium in his arteries.
That's so awesome.
That's huge.
Huge.
Because normally it grows 30% a year. He had a 20% regression. So this is what you can do to prevent and to arrest and decrease atherosclerosis, is use this vitamin and mineral and eating program.
Absolutely.
Thank you, Dr. Hotze. And if you would like more information on how to get on D-ribose and to get healthy and well naturally, you can go to Hotze Vitamins and order it, HotzeVitamins.com. And you can also call us at 281-698-8698. That's 281-698-8698. When we come back, we're going to be talking to a health fitness expert. You won't want to miss it. You're listening to Dr. Hotze's Wellness Revolution. Please stay tuned.
Dr. Hotze's Wellness Revolution, your daily dose of radio reality.
If you are sick and tired of being sick and tired and want to do a 180 and take charge of your health, then give us a call at 281-698-8698. We'll be more than happy to give you a complimentary health consultation and a complimentary copy of Dr. Hotze's best-selling book, Hormones, Health, and Happiness. It is an awesome book, by the way, and it's got great recipes in the back. I'm just saying. That's 281-698-8698. Here's Dr. Hotze.
Thank you so much, Stacy, and thank each one of you for joining us today on the Wellness Revolution, where we are creating an alternative way, and it's really a natural way. We are returning and restoring medicine to where it needs to be, where people are approached and treated using safe, natural remedies rather than toxic, poisonous pharmaceutical remedies. Interestingly enough, most physicians don't promote natural approaches to health, and there are several reasons for that. First, they're not trained in that. Physicians are trained to make diagnoses of symptoms. They call symptoms diagnoses. Diagnosis really tells you the underlying cause of the symptom. The symptom cannot be the diagnosis, but most physicians call the symptom. If you have a headache, they say you have migraines, or you have cephalalgia, which means a headache. If you have joint and muscle aches and pains, they say you have fibromyalgia, which means joint and muscle aches and pains. If you have stomach problems, they say you have gastroenteritis, which means inflammation in your stomach. It's not a diagnosis. If you have high blood pressure, they say you have hypertension. That's not a diagnosis. Those are all symptoms of underlying health problems. There's always an underlying cause of your problem, and there's a unifying factor that causes poor health, and that has to do with your inability to produce adequate amounts of energy within the power plants within your cells. Those power plants are called mitochondria. Look them up. Google it, mitochondria, mitochondria. Everything, natural doctors that take natural approaches to health know that you need specific vitamins and minerals and nutrients that the body requires and all the biochemical processes require, and the energy production capacity of the cells require these vitamins, certain vitamins and minerals, in order to function optimally. So rather than waiting for you to have low energy production because you don't have the proper vitamins and minerals and nutrients, why wouldn't you have them? Because you've been poisoned by the petrochemicals in the environment and the fluoride in your food, and you've got all these symptoms, and the doctors want to give you more toxins, and you get sicker quicker. You don't get well on drugs. Nobody's ever sick because they have a low level of pharmaceutical drugs. Nobody ever gets well because they take pharmaceutical drugs. Pharmaceutical drugs simply treat symptoms, and they're always associated with side effects, some severe, deleterious, and even fatal. So the wellness revolution that we're involved in is involved in helping people return to natural sources of vitamins and minerals and good food products and nutrition that will help them make appropriate energy and the proper amount of energy to function optimally. Now, one of the things that keeps your mitochondria, the power plants within your cells, functioning well is exercise. That's right. If you exercise and move around, the mitochondria have to work to produce energy. So it's kind of like, it's like driving a car. You know, if you got a car and you just keep it in the garage and don't drive it, you just leave it there, it kind of gets rusted. It just doesn't run well. Cars that are driven every day drive better than cars that are sitting around for 3 or 4 months and haven't been driven. They just deteriorate by sitting still. And that's the same thing with the human body. If you don't move it, you're going to lose it. So I wanted to bring on our program today Don Borgal. Donnie is the founder and owner of Proactive Lifestyle, which is located in Katy off Mason Road. And I wanted Donnie to explain his customized program, physical training program that he customizes, and the trainers that work with him customize for each individual client that comes in. Donnie, thanks for joining us today.
Thanks so much for having me on, Dr. Hotze. Appreciate it.
Well, it's a pleasure to have you here. I've been by and visited your beautiful facility over there off Mason, just off Mason Road, and I think you're right off Mason Road and Highland Malls, right? Highland
Knolls.
Highland Knolls.
It's right off of Mason and Cimarron, right down the road from Kingsland and in between Highland Knolls, correct?
Right. It's just north of I-10. So, Donnie, one thing that I noticed a difference walking into your facility, other than walking into a Gold Gym or some of these other facilities, is that you were taking, and your trainers made it a point to customize the training and the workout regimens that you have for each one of your clients. Can you explain? You used to work for Gold's. You've been in the health industry how long now?
About 14 years now.
So you've seen the way it was done successfully by these companies. They got, all over the country. You got Gold gyms or LA gyms or whatever.
Correct.
Got all over the country, Fitness, LA Fitness, etc. But you've decided to do it a different way. Explain to us your way of training, how that differs from going into a gym and lifting weights.
Well, most approaches, even unfortunately from a personal training standpoint, in a lot of the bigger box gyms are really a one-size-fits-all approach. You'll find a lot of clients going through exactly the same exercise that the individual went through the session right before them. Now, the big issue with this is that not everybody is designed the same. And we need to understand each individual structure, meaning their bones, their joint systems. Nobody has the same look and feel as somebody else. As a matter of fact, an individual may have a different structure in their body from one left side to the right side. What that means is that not everybody can move the same. So, for example, one of the exercises that have become very, very popular in our industry is everybody needs to do a squat, but not everybody's designed to do squats. So we need to look at each individual and identify what is appropriate for them, for their body, for their goals, and it allows us to get them to their goals safer, faster, and a lot more efficient than if we were just trying to fit them into this one-size-fits-all box. It also allows us to work with individuals from, I heard you talk about fibromyalgia and what the medical world would discuss, and it allows us to work with folks that fall under that, multiple sclerosis, anything with arthritis, things of that nature. So our clients really span a great deal in regards to what they're looking to accomplish.
And what you all do is customize, like we do here at the Hotze Health and Wellness Center. Although everybody has decline in hormones, everybody needs vitamins and minerals, every individual is different based upon their size, their age, their symptoms. And so while somebody we may have everybody on vitamin C because they all need vitamin C, depending upon their size, their age, and whether or not they have atherosclerosis or not, there are going to be different doses that I may put an individual on. I may know they need that, but I'm going to have to customize that, just like we'd customize our hormones. In the same way, you evaluate, if I understand correctly, and correct me if I'm wrong, you evaluate each individual client that comes in for their health issues that they have, the musculoskeletal health issues and what their goals are. And you then have to design that program that addresses those specific needs.
Correct.
Now, is this what's routinely done at most health clubs?
Is this routinely done?
Yeah, at most other health clubs, is that the way they handle their clients?
Not typically. Some believe they do, but most aren't really educated enough to understand exactly what they're looking at when it comes to the exercise approach for each individual. Our industry is very married to the idea that everything has to be a tremendous amount of movement and strain on the body, but we're not very aware of what's happening inside to the internal structures. So there's more than one way to approach that. And one of the things that you talked about in regards to the ATP was the driving of your car. But if we overdrive the car without having routine checkups, we can create structural issues to the vehicle itself. So the same thing with the body. If we're over-manipulating joints without the right type of benefit, we create or accelerate joint degenerative disease and issues. So it's understanding the right way to apply forces to the body to reduce any of those issues as well.
Well, and you made an interesting point earlier, Donnie, because you said that with your customized program and really working with that individual, you're able to get, quicker, more efficient results, correct?
Correct.
And so this is very important because what happens every year around December, about 1 million people or more, or millions of people join gyms. And then what happens sometime in January? They all drop off. People get discouraged. Life gets in the way. But
Correct.
If you've got a program where you're seeing results more quickly and you have someone working with you, you're more likely to stick with it, right?
Right. We talk a lot about nudging the needle. It's supposed to go from 0 to 1 to 2, not from 0 to 60. If you can't complete the exercise appropriately, you're not going to create the right type of physiological adaptations. And as a matter of fact, you'll just compensate and can sometimes make things even worse. So if you think about a suntan versus a sunburn, it's the same input. The result is just different. It's the amount or the exposure, right? So those things in exercise make the difference as well.
Now, Donnie, what's the website our listeners can go to take a look at your information?
It is proactivelifestyle.com.
Proactivelifestyle.com. You're located on Mason Road.
Mason Road, correct.
Okay, so we've been visiting with Donnie. Thank you for joining us today, and we'll give out this website when we come back again, but thank you so much for joining us.
Yes, Donnie, thank you. That was fascinating.
Thanks again, guys. We appreciate it.
Okay, God bless you now, my friend.
All right, you've been listening to Donnie with Proactive Lifestyle, so be sure to look that up and check him out. You are listening to Dr. Hotze's Wellness Revolution. Please stay tuned.
Why walk amongst the living sick when you can join a wellness revolution? Here's Dr. Hotze.
Welcome back to Dr. Hotze's Wellness Revolution. This is Stacy Banfield here with Dr. Stephen Hotze. And if you are sick and tired of being sick and tired, then know there is a natural way to address your health issues. You can give one of our consultants a call at 281-698-8698 for more information. That's 281-698-8698. Here's Dr. Hotze.
Thanks so much. I appreciate the opportunity to be here with each one of you. And thank you, Stacy, for being such a great co-host of this program.
You're welcome.
You're doing awesome. I love it. We'll get you on TV here one of these. In fact, we had you live streaming here in the first part of the program. Every day we live stream the program, so you can go on your Facebook to Hotze. What do they go to? At Hotze Health. Hotze Health. Mm-hmm. You go on there, and so we'll plan on having the first 15 minutes where I'm visiting and talking. That'll be on. If we have somebody on the phone, then we won't be live streaming because you won't be able to hear it them on the live stream. Maybe we can get it so we can get it hooked up in some way. I don't know, Jimbo. Anyway, glad to have you back. And of course, this program is Wellness Revolution. And revolution always involves change. And people are adverse to change. I don't care at what level you are in society, whether you're running a company, whether you're the president of a company, whether you're one of the leaders in a company, whether you're on staff for a company, whether it's in your own personal life, it's in your family, you want to make a move to a new home, you want to buy a new car. There's always change involved in life, and people are just not geared towards change. We kind of get comfortable in the situations we're in, and we just let them continue without making any change. Well, we're working in the wellness revolution. So here's a novel concept. We would like to help you be well and healthy. What a novel concept. Instead of, if I treat your symptoms, if you come into me and you have headaches, or if you got panic attacks, or if you got irregular menstrual cycles, or if you have arthritis, or if you have chest pain, or stomach disorders, or high blood pressure, or whatever your problem may be, and I simply treat the symptom to help you tolerate that symptom, I haven't corrected your problem. You still have the problem. And what you have to do, and what we want to do, and what any doctor involved in the wellness revolution wants to do, is they want to treat the underlying cause of your symptom. But most of you are going to a physician who is simply treating your symptom and has labeled your symptom as if it's a diagnosis. A symptom is not a diagnosis. It's a label. And doctors have labelitis. They label everything. And the drug companies create drugs to treat the labels. And they cause a host of health problems. So what we want you to do is consider being involved in a wellness revolution where you use natural substances to restore your health. Now, That's a novel concept, but it shouldn't be, because this is the way it's been since the beginning of time. God has put in nature, in the plants and in the food products we eat, vitamins and minerals that will enable our cells to function normally. Now, because of the way we grow foods in America now, and all the fertilizer that's used, and the fact we don't give the land a seventh-year rest, many of the food products we eat, and because they're processed, lack the appropriate and necessary vitamins and minerals and nutrients to help your body function normally. So you have to take supplements. That's why we take vitamins and mineral supplements, and I'm a big advocate. You know, somebody might say, well, Dr. Hotze is just a vitamin doctor, and I'll proudly say I am. I believe that vitamins, given in the appropriate dose, and minerals can enable your cells to get healthy so they produce energy so you're not sick. I want to get your energy level up, and I know if we get your energy level up, your body's going to heal itself. My daddy told me long time ago, back when I was in med school, he used to say, God's given the body amazing restorative power, that it will heal itself. You think about it, you break your leg or you cut yourself, it heals. The body heals on its own. Now, you may have to put a bandage on it, wash it and all that, but the body heals itself. The broken bone heals. But if you wreck a car or scratch a car, it doesn't heal itself. Something's got to be done. But the human body, God's given amazing restorative powers. And that's why we need to use the restorative power of the body to heal ourselves instead of relying on toxic, poisonous substances that are given to us by the drug companies and prescribed by physicians. Now, let me give you an example. I mentioned a friend of mine had come in today that I saw this afternoon, a guest of mine, a longtime friend too, for well over 30 years. He was being seen by one of my other physicians here several months back. This goes back into August. And was recommended that he have a heart scan. Now, my friend's, he's about my age. He's in his late 60s. And so he didn't want to get a heart scan. I've been on these vitamins for years. Dr. Hotze's been giving me. I'm fine. My heart's fine. I don't have any problems. I've done a stress EKG. Everything's good. So I walked in and told my buddy, I said, now listen here. We're not going to know if you have any atherosclerosis or coronary artery disease unless we do a heart scan, because it tells you if there's any calcification in the arteries. It's a non-invasive test. There's no other way to do it non-invasively to know. You can do a stress EKG. You can do a echocardiogram. That all can be normal, and you still have atherosclerosis or hardening of the arteries. And remember, hardening of the arteries or atherosclerosis is what leads to heart attacks. That's what leads to heart problems. You want to keep the arteries open and patent so you get plenty of blood and nutrients to the heart muscles, which require these to create the tremendous amount of energy to let the heart function normally. So anyway, we got a heart scan on my good friend, and it turned out it had a very high score. And that enabled me then to make some recommendations of some specific vitamins and minerals that would help arrest and reverse his hardening of the arteries. And we just did today a 9-month recheck on his heart scan, and he had a 20% reduction in the plaque buildup, in the atherosclerosis, and the hardening of his arteries.
That is terrific.
That's remarkable. And that's what you need to do. You need a heart scan. If you're above the age of 40, find out now and reverse it.
That's right. It's better to know. You cannot manage what you don't measure. If you'd like more information, then give us a call at 281-698-8698. That's 281-698-8698. You're listening to Dr. Hotze's Wellness Revolution. Please stay tuned.
Now back to Wellness Revolution, your 100% organic, farm-raised, grass-fed, gluten-free, cage-free, non-GMO radio show. Here's Dr. Hotze.
This is Dr. Hotze's Wellness Revolution, and we are on a mission to help you achieve health and wellness naturally. If you would like more information on doing a 180 and taking charge of your health today, then call at 281-698-8698. That's 698-8698. Here's Dr. Hotze.
Thank you so much, Stacy, and thank each one of you for joining us today on Wellness Revolution. We hope the information that we give here will cause you to want to do a 180 and take charge of your health. Let me make some recommendations for you. If you're above the age of 40, I think it's really important, in fact, critical, to do a baseline heart scan. We do a heart scan, all our guests 40 and older. We do a heart scan, and the heart scan measures whether or not there is any calcification of the arteries that feed the heart. You got 3 or 4 main arteries that we're concerned about. You've got the right coronary artery, you have the left descending coronary artery, you have the main coronary artery, you have the circumflex artery. And we take a look at these arteries by a scan, and we can measure if there's any calcification. Calcification of the arteries is indicative that your arteries have been inflamed. Now, I'm telling you this, folks, because I don't want any of you to develop heart problems. And heart problems, particularly heart attacks and coronary artery disease, are preventable. If you have them, they're arrestable and reversible. Naturally, wouldn't you rather prevent a problem from occurring than to have a heart attack and have to go through and have stent and bypass surgery and all that? You're not going to hear this from mainstream medicine because there's a huge, huge industry built around cardiology, and that has, the placement of stents, the coronary angiography, all the hospitalization, the bypass surgeries. That's a huge multi-billion-dollar business. So it's not in their vested interest of the hospitals, of the pharmaceutical companies, of the conventional doctors to upset that, because if patients didn't get a heart disease, they wouldn't have any surgeries to do. I mean, if they didn't get coronary artery disease, or we dramatically decrease the incidence of that, there'd be much, much less work. That means there's less income. So not to say these doctors don't do a good job when they get you, when you have the problem. My goal is I don't want you to have to end up with a cardiologist or a cardiovascular surgeon. I want to help you prevent that. And if you'll listen to me and follow some simple recommendations, you can dramatically increase your risk of developing coronary artery disease, which leads to heart attacks, and ischemic vascular disease, which could lead to strokes. And the way you do that is that you keep your arteries healthy. When they get inflamed, you've got to heal the arteries. And the way you heal the arteries is with vitamin C. How many of you have had your doctors tell you to take vitamin C? Few and none, I'm sure. But vitamin C, if we were to eliminate vitamin C from your diet altogether for a period of 6 months, you would be dead within 6 months to a year. Your tissue on your skin would deteriorate, your gums would bleed, your internal organs would bleed, you'd get dementia, you'd have numerous infections, your immune system would falter, you would die. You can't live without vitamin C. Well, so if vitamin C is that important that if we don't have it, it kills it, it must play a significant role. And it does. It plays a significant role in heart disease by helping your body make collagen, which is the protein that heals the arteries. So you need vitamin C, and that's very important. So if all a person does is take vitamin C, 1,000 milligrams per 25 pounds of body weight, that will be tremendously helpful in helping you prevent any coronary artery disease. Additionally, magnesium is essential and important because magnesium helps the production of the energy molecule within your cells. It also relaxes the muscles that line your arteries, the smooth muscles, so it lowers blood pressure. It also regulates your heart rhythm. It also helps with new bone formation. It also calms the brain. Magnesium is very important, and most Americans are deficient in magnesium. So most Americans are deficient in vitamin C. They're not low enough that they get scurvy, but they don't have enough vitamin C to adequately produce the amount of collagen they need when their arteries become inflamed. And most Americans' arteries are going to be inflamed. Why? How do they get inflamed? Because of the petrochemicals of the environment, because of the heavy metals in the environment like mercury and aluminum and lead, and because of bacterial infections or viral infections throughout our lifetime. All these inflame the arteries. The most commonly inflamed is going to be the heart because it's under the most stress. So what you want to do is take vitamin C, magnesium, and then you want to help your cells produce energy. The heart needs more energy than any other organ in the body because it's beating all the time, 72 times a minute, 100,000 times an hour. You've got to get energy in your heart cells. And you do that using coenzyme Q10. You use that with carnitine that helps you pull fat in and convert fat to energy. Use it with D-Ribose. It helps you build, and we talked about that earlier, D-Ribose powder, which contains ribose, which is the building block of your energy molecule in the cell, ATP. Those are key. And then you also, if you have coronary artery disease, you use lysine and proline, which are 2 amino acids, and K2 to help pull the calcium out. Now, this is a program that we use here at the Hotze Health Wellness Center. I just did a heart scan, a repeat heart scan after 9 months on a good friend of mine who's been on my program, been on the Hotze Health and Wellness Center program for, 20-something years. He's done well, but we'd never done a heart scan on him. And when I did the heart scan, he had a very high score in August, very, very high. Went up to 1,600 almost. I just repeated it. When I found out that his heart scan was high, I put him on additional vitamins and minerals to help suck the calcium out of the walls. And that's what we did. So he came back today, 9 months later, and we had a 20% reduction in the calcium load in his coronary arteries. That means he has less atherosclerosis. He has a decreased risk chance of heart disease now, and he had a high risk. And so we're cleaning up the arteries, and they were giving him the proper vitamins and minerals and nutrients to help those heart muscles produce energy. He's lost 30 pounds in the last 8 months or 9 months. He looks great. I asked him what his energy level was on a scale of 0 to 10. He said it felt like $1 million. He runs a large company that's been in business for over 70 years. He's a great guy. He's 72, doesn't want to retire. He's going and blowing. Now, how many people do you know at that age that are going and blowing? And he is, and we're helping his heart stay healthy and get healthy by arresting and reversing his hardening of his arteries. And that can be done. That's what we do here at the Hotze Health and Wellness Center is we help you get on a path of health and wellness so you can live a long, fruitful, enthusiastic life full of vitality and energy and be very productive. That's what our goal is for you, and I want you to join the wellness revolution, so give us a call today.
That's right. You, too, can be a success story like his friend. We would love to have you live a healthy and wealthy life, and if you're 40 or over, then definitely you need to come in and get a heart scan done. We'd love to do that for you. You can call 281-698-8698. That's 281-698-8698. You've been listening to Dr. Hotze's Wellness Revolution. Have a blessed day, everyone.
Information provided on this radio program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution radio program advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this radio program is at the listener